College of Medicine and Friends of Baylor. Well, my sister told me I needed to go out and vote, so, in the words of Mayor Daley, vote early and vote often. I didn't really vote 3 times. I'm just going to take this off so I don't get in trouble. Well, maybe I didn't vote 3 times. Janet. Anyway, just once. I tried. No, I didn't try. All right, well, I want to start off this week. A lot of stuff is going on. So let's start off with our TEFI data, the one from the Texas Epidemic Public Health Institute, because it really shows what's going on early. So this is wastewater analysis in most of Texas. And what's interesting is same virus that's up, we've been talking about for weeks now, enterovirus. But influenza A just beginning to tick up. You can just see that little bit of ticking up. And we still have a lot of mPox around, which is kind of interesting. And all the viruses you begin to worry about, RSVs beginning to tick up, parainfluenza beginning to tick up. But the mPox thing is really interesting. And we have a lot of mPox, and there's a lot of mPox that's around in the country. And just to remind you, we talked about this about a month ago, but just to remind you, there are 2 varieties of mPox, one called clade 1, which is mostly in the endemic part, Central Africa, and clade 2, which is mostly in West Africa. And clade 1 is pretty bad, and that's what's the WHO announcement, but the health alert is clade 1. Clade 2 is not as bad, and that is what was around in 2022 and still remains in the U.S. today. Now, these things are, mPox looks like any other pox-like illness, chickenpox, whatever. You get sort of these lesions that are pustules, and they form very discrete circular rings and then have a little center that is necrotic. That looks very different from measles, which is a flat rash. It usually starts at the top of the scalp line and goes down, hands, all over the body. This is usually, pox is much more discrete and easily differentiated. As I mentioned, clade 1 is the bad one, clade 2 is the one that's been circulating around in the United States. Now it is spread to all 50 states, and it's mostly in men who have sex with men. If you look at it in the United States, the largest number of cases is in California, over almost 5,000 cases, 4,000 in New York, and over 2,000 in Texas. So the big concern is this clade 1 that's taking place in the Democratic Republic of the Congo. And that is a disease that mostly affects children. And the reason it affects children is it's in household contacts. The reservoir is in rodents we don't have a reservoir in the United States. It's the animals that contain this virus are in Africa. And it's usually spread in households because children are in close contact with each other. There's a lot of crowding. There's no disinfectants. Often malnourished children. These are not the kinds of conditions you see in the United States. And so that kind of close household transmission isn't how it's transmitted here. As I said, mostly it's men who have sex with men in clade 2. But this clade 1 outbreak is in households. But because it has such an impact on children, there's a big push to develop a vaccine for this. There is a vaccine for adults, but it hasn't been looked at in adolescents and children. But Dr. Mary Healy and our own faculty presented results of an mPox vaccination study in children in LA this past 2 weeks ago. And it's very similar. It's a vaccinia. Vaccinia is a virus similar to the pox virus, but less severe. This particular study was a phase 2 clinical trial. And what they found was a very good immune response in adolescents. So it's really good. First time that they've looked at it in a younger population. And it's really needed because what they really need to do is create this vaccine and give it and send it to the families and children in need in Central Africa. Now on the bird flu side, big news. I've been very worried about this. The USDA just announced that they had detected H5N1 in a pig in a backyard farm in Oregon. Now, I've said many times this is a real concern if it gets into pigs because there have been a lot of flu viruses that are transmitted that have caused pandemics. The H1N1, for example, was a plant pandemic caused by jumping from swine to human. That's a real concern, and I think frankly, I think the CDC needs to be doing a little bit more than what they're currently doing. There's not as much concern because it's a local farmer, just small farm. They eliminated the animals. It's not like it was in a giant swine factory type farm, but it's still a real concern. It's a real concern. In addition to that, bird flu cases continue to increase. We're up to 36 in California. They reported their 15th infection in dairy workers. Washington State had its 7th case in poultry workers. And it's probably worse than that. We don't really have great surveillance because the only way to do surveillance on this is if the farmers or the state request it. There's no mandatory testing, which is another thing that needs to change. And the surrogate marker for this is the number of cats dying on the farm. I know Lily was quite thrilled with that. But what happens if cats are around a dairy farm and they're drinking unpasteurized milk, the cats get it and perish. And so that's been a big thing. Now, what we're seeing is an increase in cats dying in their community. And presumably that's because they've been infected by a wild bird that had it. But there have been a lot of increase in domestic cats that are dying. This is, of course, a great concern. And the only one who's celebrating that, of course, is Lily. So far, there have been no cases of cat to dog transmission. I'm happy to report. Lily, no worries there. She looks very relieved. And no cases of cat to human transmission. But still, it's just a lot of virus around, and this thing entering into swine is a real concern. A total of 36 cases now in humans, and remember that one Missouri case I mentioned where there was no exposure on a dairy farm. We still don't know what happened, but they looked at the 6 healthcare workers that took care of that woman. One was, to test to see whether or not there was any chance of transmitting from that patient to the healthcare workers. They were all negative, all tested either by PCR or by serology. So still no evidence of human-to-human transmission. The CDC continues to say bird flu is low risk, but it's just so prevalent. I think, as I said before, I think they should be trying to vaccinate at least dairy cattle and the people who take care of dairy cattle and poultry farm workers. I mean, I don't understand it. But because there's a concern, a lot of laboratories are amping up. Quest just announced that it's going to start launching a bird flu test soon. There was also a couple of papers, editorials that have been published in the last week of vaccine and infectious disease experts saying that the CDC really may not be prepared in case there is an outbreak. I know they're stockpiling vaccines. I know they're making them. We're increasing the testing opportunities, but I think we should probably be doing a little bit more than that. Now, I mentioned this little bump in seasonal influenza A in Texas. If you look at the deep sequencing of that, this is the Texas data. You can see, nothing in week 40 or whatever this is. You can see this big spike in October. If you look at the national data in wastewater, that's just Texas. If you look at the wastewater, it looks like it's flat, but there actually is a little upturn. You can see it just beginning to peak up. And if you look at the 23-24 season, last year's influenza season, really the inflection point was week 42. You can see just beginning to increase. This is week 42, by the way, or 42 or 43. I forget what it is. But this is the national data. You can see it's beginning to rise in week 42. So I can pretty much predict the flu season is upon us. It will be peaking just like it did last year. I wanted to show you that. Last year it peaked right at the end of December. Between December and January was the peak, and then it started coming down. So from now on until the end of December and the holidays, we're going to be having a lot of flu. So if you haven't gotten your flu shot yet, please go get it. Now, COVID, some interesting studies on COVID. Right now it's not very active. You can see generally, nationally, it's kind of low, but there are states that have some COVID activity. So it's not evenly distributed. You can see in New England, you can see, up here in Oregon. There are states, Wisconsin, that have some increases in COVID. Mostly it's, as I said, localized. The national data is pretty good. There hasn't been an increase in emergency room visits or hospitalizations. but it's around. And so the concern, of course, is that it will begin to pick up as well. The dominant strain is that XEC strain. It's up to 17%. I just want to show you JN1, which was the dominant variant last year, is pretty much gone. So this evolution happens, and now we have new variants. The Travelers program is interesting. That's the 8 airports and testing wastewater in planes and airports. It's coming down too, but not as fast. Finally, it's taken a while, but XEC is the dominant strain, now 18% in the Travelers program. And for the first time, the UK just announced that they have begun to see increase in patients testing positive. So it went from 3.7 per 100,000 to 4.5 per 100,000, and they're attributing it to the new variant. So like always, what happens is you have immunity. If the immunity wanes over time, 6 months, 7 months, and the virus changes, all of a sudden you're able to catch the virus because you don't have an exact antibody match to what it is. Interestingly enough, the CDC, and this is important because this is a new recommendation, the CDC has recommended a second dose of this year's vaccine for people over the age of 65 or for people who have severely immunocompromised. So that means, like me, I've got my flu and my COVID vaccine about a month ago. In spring, we're going to have to get a second shot because the mRNA vaccines that we've been saying all along, the weakness is they are not that durable. They only last for about 6 to 7 months. So the CDC has already recommended if you're over the age of 65, plan on getting your second dose. Now, there are a couple of interesting studies that came out. First one that's really kind of interesting is that there's a large study in the United Kingdom, 10,000 people looking early on in the pandemic. So this was like before there was a vaccine. They looked at 10,000 people. And what was interesting is that there was a large increase in risk of heart attack, stroke, and death. So we've talked a lot about those. Early on, the virus was a little bit more virulent. In other words, it caused more disease in people. But the risk of heart attack, stroke, and death was twice as high in COVID-19 patients who just got a little bit of but 4 times as high in those who had severe disease. So the first evidence that there was really a cardiac risk for people who had COVID and were unvaccinated, but that was early on in the pandemic. The virus has changed quite a bit, and we think it's probably less virulent. In other words, causes less serious disease. I want to end today with a bunch of shout-outs. First of all, congratulations to our own Dr. Huda Zoghbi, Professor of Molecular and Human Genetics, who's been invested as a member of the American Academy of Sciences and Letters in recognition for her outstanding contributions to science. She's also a Howard Hughes investigator and founding director of the Jan and Dan Duncan Neurologic Research Institute at Texas Children's. Also, we received a grant from Bristol Myers Squibb Foundation to look at cervical cancer in Malawi. We've done great things in sub-Saharan Africa, and this mostly focused around HIV. This is a grant of about $2.5 million to study and improve both prevention and treatment of cervical cancer in women. It's a very high burden in Malawi. In addition, I want to congratulate Qiancheng Zhao, an assistant professor in the Department of Medicine, who was awarded the Science and PINS Grant Prize for Neuromodulation that recognizes outstanding research performed over the past 3 years. That Dr. Zhao's research is focused on mapping the body's internal sensory communication highway. And finally, next week is National Allied Health Professions Week, where we recognize the outstanding work of all of our Baylor Allied Health faculty and staff, as well as the trainees in the School of Health Professions. Allied health professionals are a key component of the medical healthcare delivery system, so we appreciate all the work you do. I hope everyone had a wonderful Halloween. Lily's still not talking to me because I dressed up as a dog catcher, but I didn't know. I thought she wanted to do that. Anyway, have a great weekend. Can't wait to see you next week.